The Children's Mental Health Week is set to kick off from the 3rd to the 9th of February. So on the program this morning, we are shining the spotlight on the digital world and how extensive use of social media can lead to addiction. There's a number of reasons why children's mental health can be impacted by online activity, such as the amplification of social network feeds and instant messages accessibility. Now, to help us discuss some of the impacts of digital or social media and mobile use among the youth, we're joined by the founder of MySociaLife School Initiative, Dean Mukubri, who is in our Sea Point studios in Cape Town. A very good morning to you, Dean. Let's start with, how do we define social media addiction and what can lead one to becoming addicted?
So I think the term addiction is extremely strong because, of course, there are some children which are addicted, but addicted normally relates to an obsessive use that can go so far that it causes some type of harm either to the psychology or to relationships or to their schoolwork and so on. So addiction is really when that obsessive use dials up. I think our kids are suffering more with the obsessive use. Sometimes it doesn't actually cause that level of harm in terms of relationships and so on, but kids are actually looking down a lot at their devices, and they no longer know how to actually self-regulate and self-discipline themselves with regards to being able to turn it off or turn it over and just take a break. And I think that's where they're feeling quite trapped and actually feeling a little bit isolated.
Speak to us about the MySociaLife initiative and the strides you're making in trying to curb this issue of social media addiction or excessive use amongst the youth.
Yeah, I worked on this program. I worked in media for 20 years, and I actually worked on this in my own time for 2 years, actually examining how the media is actually affecting kids. And then I created 8 modules, 8 one-hour lessons, which we take into schools and we teach them over the course of a year, so maybe 2 lessons a term. And those lessons include, what is your digital identity? How are you setting up your privacy boundaries? What types of hacks could you experience in terms of people trying to make contact with you? What happens with sexuality and expressing yourself as a male or a female online? What does that look like? We talk about empathy and bullying. We talk about resilience, how to cope with when people flame or troll or shame you. It's a really in-depth course because we believe we need to break down the case of the internet and then rebuild it back up to be something much more positive. I think we've received these devices they started in 2007 for the phone and the tablet in 2010. And just in the last decade, it's kind of crept up on adults, teachers, and students. And people don't really know that there's this extent of problems to be educated about. And so that's what our program does. But we also teach the teachers as well, and the parents, and we teach GPs, and we teach psychologists. We believe everybody in the line of custodianship, as well as the children, need more education.
And speaking of psychologists, what are some of these psychological problems and disorders that are linked to the extensive use of social media, particularly among the youth? I know anxiety has become one of those things that are really at the forefront.
Absolutely. I mean, I would say for us, going into schools, we would say anxiety is probably number one. As I'd mentioned, we train psychologists, and Dr. Diaga at the Red Cross Children's Hospital Africa in the child psychiatry unit was talking to me about the increase in cutting and self-harm. That seems to have seen quite an increase at the moment. There's also depression. We look at things like obsessive compulsive disorder, issues around the body. There are a number of different issues that can trigger from the different aspects of life online. So you could be comparing yourself to others, which could trigger something around your body, for example, or you're seeking this level of perfection which you can't keep up, and it makes you feel extremely anxious and extremely tense. You could feel like you're not good enough, which can make you a little bit depressed. It's very interesting because only when we understand through the hours and hours of exposure per day that some kids are getting, that they are actually being triggered internally to make themselves not feel good enough or not up to scratch or extremely frustrated or aggressive, and they need to process it. That's why we teach the adults. They need the help from teachers and from principals and school counselors and even their GPs to ask them the right questions.
But Dean, do our teens and preteens even stand a chance? I mean, just looking at only social media sites, there's Facebook, there's the likes of Twitter, there's Instagram, and then there's access to dating sites, and then there's games. Do our teens or kids or youth actually stand a chance? Because it looks like everything has been created and tailor-made to be easily accessible and to be found online.
It's an amazing question, really. I'd like to say they don't stand much of a chance, but I think they stand a better chance if a program like ours can be adopted more and more. It doesn't just have to be us, but I think we are definitely examining and unpacking what is happening online and trying to guide the adults and the caregivers about what the correct boundaries are, what the correct settings are, what the importance of time offline does, because we are humans. We have 40 plus muscles in our face, 600 muscles in our body. We need to experience these messages face to face in order to feel connected, in order to be able to process things, in order to not feel isolated. So I do believe there is a chance, but I believe that there needs to be almost a curriculum in school, and we need regulators and we need government to do more to be able to provide a much more robust set of boundaries, a much clearer and crisper container of what is and what isn't acceptable from a mental health point of view, and then to guide them about how they set up their phones and how they engage. And I mean, if you just look at bullying, if you just look at, even for adults, you look on a platform like Twitter and you look at the level of abuse between adults who are so cross with other people's opinions, that we need to allow people their point of view and their difference, because we realize that's just their point of difference and we can't do that much about it.
Dean, very well said. Thank you so much for your time. I wish we could carry on the conversation, but time is up. Thank you. That is Dean Mukubri, the founder of MySociaLife School Initiative, for speaking to us more about Children's Mental Health Week and some of the effects of social media addiction or excessive use on children's mental health. That's why I'll leave it for the moment.
Lovely.